My name is Melissa McGuire. This is my leadership presentation on leading through the prolonged crisis of COVID-19. So this is my abstract here, just a quick overview that first off, that the prolonged effects of the COVID-19 is certainly multifaceted. The one area that's affecting our facility, arguably to the greatest extent, is the staffing levels or the impact it has had on staffing. It has certainly exacerbated the issue of nurse retention, and this staffing crisis negatively impacts patient safety. It increases stress on the nurses left behind. It's certainly costly and has caused a lot of animosity between administrators and frontline workers. For these reasons, it is important to implement leadership strategies that are designed to reduce nurse burnout and nurse turnover rates, in return creating supportive environments and encouraging resilience. The target audience are nurses that lead at our facility, including unit managers, clinical leads, and charge nurses. Structural empowerment is a transformational leadership strategy used to enhance job satisfaction, and enhanced job satisfaction has been related to decreased patient adverse outcomes, as well as decrease in nurse burnout and turnover rates, because nurses are simply happier working. The Cultural Change Toolkit is another evidence-based approach aimed at making positive practice changes. And this is based on meaningful feedback from leaders. There's shared decision making and increased leadership support and involvement on units. Qualitative and quantitative data from self-reported surveys and statistic analysis can be used to evaluate how you are implementing these leadership strategies in your own setting. The number of nurses that report burnout and voluntary turnover before and after implementation of these strategies, that's a great comparison to use. And then this feedback can be used to inform change in managerial and leadership constructs, as well enhance our understanding as nurse leaders, our subordinates or our nurses' perception of working environments and their perceived supports. So let's just dive into this issue a little bit deeper. So we're talking about the retention of registered nurses. Definitely not a new issue. We have heard about it for years. It's not an issue specific to our facility, but it is a global health crisis, and it has been exacerbated by the COVID-19 pandemic. The pandemic has had an immense impact on nurses' psychological well-being, the quality of working conditions. We're seeing overcrowding in acute care settings and scarcity of beds and resources. This cultural shift has been paired with the increased reports of job dissatisfaction, higher rates of burnout, and increased turnover rates among nurses. These current working conditions and the perceived lack of support really accentuates what researchers will call the frontline worker fatigue. So nurses are reporting that they feel an incredible level of pressure to deliver competent, safe care while working short-staffed and with limited resources. Oftentimes, this is sometimes, I should say, this is looking like mandatory overtime or lengthened shifts. And again, short staff, so you're doing, there's higher patient to nurse ratio, and there's a lot more stress involved with managing your workload. This level of fatigue is felt among a lot of nurses right now. And then also with our interprofessional partners or members of the team, including physicians, support staff, and administrators. We are seeing an overburdened emergency room, overflowing inpatient units, and it has resulted in a constant game of bed movement and nursing reassignments. This increasing rates of burnout and nursing turnover in the aftermath of the COVID-19 pandemic is certainly important to address. There's a few reasons listed here to why it's important to address. Obviously, it has, first and foremost, it has a negative impact on patient safety. It is a huge organizational expense when you consider the financial burden of training new staff, covering sick time, leave of absences, and then adverse outcomes for patients, prolonged stays, as well as adverse outcomes for staff. It also increases the stress and strain on the remaining nurses, which only perpetuates the problem. And then these high stress environments has unfortunately increased that animosity between administrators and the frontline workers, and that's interrupting the managerial guidance, support, and leadership. So it's hard to predict exactly, or it's hard to address what are the most important factors here to consider. but organizational factors like leadership involvement and support, really advertising that shared decision making among teams, focusing on changing staffing and financial incentives, and then also as simple as employee recognition are some factors in the literature that have been proposed to combat these problems regarding nurse retention. The first step, though, is to educate you, nurse leaders, on useful evidence-based leadership strategies that are designed with the goal of supporting teams and encouraging nurse resiliency. Improved nurse and patient outcomes have been linked with more supportive team environments, and then encouraging resiliency will hopefully the aim of it is to decrease level of workplace fatigue, that perceived burnout, and that desire to leave the profession. So the target audience for this presentation includes all team leaders, including at our facility that may look like charge nurses or clinical leads, unit managers that come from an array of backgrounds. Also, what we at our facility we call operational leads. So these are nurses on duty at a given time to help with nurses and units when required. They also assist facility resource administrators that are not medically trained in bed board management and OR scheduling. So by the end of this presentation, as at nurse leaders, hopefully you'll be more familiar with the application of transformational leadership style in healthcare, and more specifically, being able to apply strategies related to structural empowerment that will hopefully create a more supportive work environment for you and your staff. And then the second objective is to be more familiar with and apply the cultural change toolkit that's designed to strengthen collaboration among your staff, and then as well as nurse resiliency. So what is the ultimate end goal or the vision here is for nurse leaders to understand that their role in creating supportive team environments and encouraging resiliency among their staff members. So we're looking at information sharing, resource allocation, and really addressing nurses' professional as well as personal needs to facilitate change to combat the prolonged impact of COVID-19 and the impact it has had on nurse retention and job dissatisfaction. The goal is that the adaptation of transformation leadership styles and cultural change toolkits will enhance leaders' approach to teamwork and efficiency. Current literature supports transformational leadership style in healthcare. Theoretically, this style generates trust, promotes integrity, and contributes to greater effectiveness of the leader. These leaders are said to be visionaries. They encompass skills, characteristics, and demonstrate behaviors of a role model that in turn motivates, empowers, and engages followers. This team-focused approach to leadership really captivates, excites, and supports followers to meet their full potential in pursuit of shared goals. The style of leadership it contains 4 components: the idealized influence, so acting as a role model; inspirational motivation, so this is using good communication skills; optimism, to inspire confidence and empower your followers; intellectual stimulation, so encouraging creativity and making all members part of the shared decision-making process; and then individualized consideration, so you're not just focused on your own goal as manager, you're not just focused on organizational goals or requirements, but you are also addressing the professional and personal needs of your followers. Leading by example has been found to be one of the fastest and easiest ways to teach. And then as a nurse leader like yourself that acts with integrity, completes tasks, and while demonstrating a positive attitude, you're going to be a great motivator. These leaders naturally influence followers to do the same. And then it's also fundamental in creating a supportive team environment. Transformational leaders stimulate employees' sense of gratitude, companionship, and respect and trust. By being an active member of our teams, transformational leaders also promote cooperation and improves interprofessional relationships, reduce conflicts, it increases trust, and then creates that healthy, supportive work environment that we're all after. So the theoretical definition sounds great, but we're asking ourselves, what strategies can we introduce in our own practice to actually address or combat the prolonged effects of COVID-19 in respect to nurse retention? So earlier I stated that the pandemic has perpetuated this staffing crisis with higher reports of job dissatisfaction, higher rates of burnout, and higher turnover. Well, one transformation leadership strategy proven to enhance job satisfaction in particular is structural empowerment. So nurse retention, we know, is a multifaceted issue. However, creating a supportive work environment by empowering followers may be one of the most important retention strategies because it enhances job satisfaction. In this study in particular that this diagram is from, we're looking at transformation leadership and how that increases structural empowerment among subordinates or your followers, your staff members. And then because of that, we have increase in job satisfaction and then decrease in adverse patient outcomes. However, this job satisfaction or increase in job satisfaction has also been proven to increase nurse retention, increase that organizational commitment that some of us have lost during the pandemic, and then also increase resilience. What does structural empowerment actually entail? It's just a word right now. Well, with structural empowerment, because the reason why it increases job satisfaction is because researchers are seeing that it's increasing respect among colleagues. It's developing open and trusting relationships between followers and leaders. And then nurses are feeling empowered, so they feel more in charge. And then they're also sharing the decision making. When nurses or any followers with that regard, when they feel as if their leader is taking interest in their development, they are going to feel more empowered, they're going to develop more confidence, and then they are going to be more engaged in this organization. These leaders can communicate very clearly their mission. They hold themselves to high expectations as well as their followers, and then they produce a sense of commitment that encourages followers to do the same. The theory of structural empowerment is based on 4 things. So that's access to information, access to supports, access to resources, and access to rewards. And as leaders, these are the things that you can facilitate. So access to information includes making your followers aware of organizational goals, having them participate in developing shared values, and then also advertising policies or procedures and enhancing that technical knowledge among your staff members. Access to supports includes guidance and meaningful feedback, as well as social and emotional supports, because we're all human, and it feels good when our needs are addressed. And then access to resources, this refers to physical resources like material, supplies, as well as funding, and then equipment that actually works so that you can do your job better. And then finally, access to opportunities, and this or access to rewards, so this is opportunities for growth and mobility. It includes professional development. So are you promoting leadership conferences or conferences or learning lunch and learns to develop more skills, relevant skills? And then are we rewarding our followers? As simple thing as just providing recognition in the morning huddle. So with this, I'm hoping to address ways that you as a nurse leader can promote structural empowerment on your staffing units so that you yourself can see an increase in job satisfaction. And then hopefully these nurses, even at a small level, even in like your unit itself, are hoping to stay for longer. The next theory-informed leadership strategy to address this challenge is what is called a cultural change toolkit. So from the onset of the pandemic, culture in healthcare has certainly changed. And then the first step of this is to ask yourself, what is your unit's culture? And if you can't define that, that's a best place to start. So some leaders can come up with concrete definitions and some may not. And so I challenge you to ask yourself, what is your culture? And unfortunately, in times like this, post-pandemic, when we're faced with deficient resources, bed scarcity, staffing shortages, that cultural definition is often forgotten because we're just going through the daily grind of trying to get work done and do it as safe as possible. But culture is important. It's really the definition of how we work together. It incorporates our unit's values, our beliefs, habits, what we expect from each other, and then what we regard as normal behavior. A better culture, instead of because we've always done it that way, means better outcomes for our patients. Most common cause of adverse patient outcomes has been linked with communication breakdown, and then better culture is also linked with improved psychological health of providers, increased engagement, and then again, increased job satisfaction. A weaker or more stressful team culture is associated with more near-miss events for patients and providers alike, increase in distress, and then also frustrations in the workplace. This cultural change toolkit was designed and tested to improve nursing work environments with the goal of addressing specifically burnout and turnover rates. So according to Adam and his team, this toolkit facilitates a significant reduction in the self-reported rates of burnout among nurses. This is great. This is what we need. The three key components that they said are the biggest factors to actually decrease burnout rates or self-reported burnout rates and self-reported intent to leave the profession include simply meaningful recognition, including them in shared decision making, and then increasing your leadership support and involvement in the unit or on the unit. So that's being accessible, and that's being involved. This toolkit is way cost effective. And it is an easy intervention to implement. So first, I challenge you as our first step is to define your current culture. Then there's 6 detailed steps that outline the process of redefining a new culture as shown here. So first, you're engaging all the people. You're engaging your staff. You're engaging everybody up until your support staff, your nurses, your physicians, and then your patients because they're a very valuable source of information. You're setting a foundation, assessing the current state of things, identifying and analyzing opportunities for the future, and then you're going to choose specific tools. And then the best thing is that you're going to test these changes. So you're making those SMART goals, you're making things that are measurable and timely, and then you're going to test to see, are we actually seeing a decrease in our self-reported nurse burnout rates and turnover or intents to leave? And that's how you can tell if this toolkit is working or where you have to make changes to. This level, so collaboration on value. So part of this is not just engaging them, but having them to collaborate on shared values and vision statements or mission statements. And because then the people can actually, or followers, develop their a better understanding of their roles, and then also will develop more responsibility in their responsibility, their part in making a culture a more supportive environment. Now, all the things that I'm talking about, shared leadership, shared decision making, and then recognizing that each member has their specific roles and responsibilities. It sounds a lot like collaborative leadership style. This isn't necessarily mentioned in the toolkit, but if you think collaborative leadership, it's centered around cooperation, knowledge sharing, and experience. And then like the cultural change toolkit, this approach to leadership definitely promotes shared responsibilities. And then it's very helpful across groups with people with multidimensional skills. And we see that all the time in nursing. So these people, they come with all these different skills, and then they are able to collaborate and produce new ideas and produce new policies and then new support systems to make your unit the best it's ever been. And nursing is, as we all know, extremely complex and very diverse, and the best source of information is from each other. And then really accessing what you're good at, your expertise, and bringing in those experts to share their wealth of knowledge on these new ideas or new approaches. So we're thinking from everything from upper to middle management and bedside nursing. We rely on these skills and ideas from all these members to successfully develop a culture, successfully develop policies, and implement standards of practice that we can all abide by, so that we are meeting each other's expectations and ensuring the safe patient care and a supportive environment to work in. So promoting that buy-in from all staff and really promotes hard work, resiliency, dedication, and again, bingo, increase in job satisfaction. This rebuilding following the pandemic has the potential to reverse nurses' intentions to leave the profession, alleviate burnout, and decrease turnover rates. If we just take a second, I included a link here if you want to click there after the presentation. It'll take you to what BC is using to apply this toolkit in their nursing settings. And it is a lot of valuable theory-based or literature, research-based tools in order to enhance that culture, enhance shared decision making, and then what does meaningful feedback actually look like, and why is this making such an impact for nurses? So what's the next step? So you're here at this presentation. I tell you what the issue is regarding the prolonged effects of COVID-19 regarding the nurse retention crisis or the staffing crisis. Then we talk about transformation leadership and the cultural toolkit, the cultural change toolkit, But then you're going to leave this presentation and you're going to say, oh, those were great takeaway messages. But then the value of it is that we can evaluate if these measures or if these leadership strategies are actually making a change, and if we're actually meeting a more supportive environment, and if our nurses are feeling more resilient. And this is great because these goals can be measured, or these objectives can be measured with both quantitative and qualitative data. Qualitative data would include nurses' perception of their work environment and job satisfaction. This can be evaluated following the shift to transformational leadership style and the implementation of structural empowerment through even just a self-reported survey, email style, in-person conversation. There's also that quantitative data. So you're going to look at the rates of burnout. You're going to look how many people have left the nurse at your unit or have the intent to leave, and those actual numbers to quantify whether or not these changes in transformational leadership approaches to leadership and the toolkit, if they actually made a change to your culture on your unit. The difference in these values will definitely determine if it was a successful implementation, or if you're looking at your SMART goals, maybe it's time to reevaluate, okay, maybe I didn't do as much as promoting structural empowerment as I should have, or maybe this isn't working for my team members. What additional information do they need? Is it additional resources in order to feel empowered? With regards to leadership challenge identified with respect to the nursing retention and supporting teams and encouraging resiliency, ask the patients, the participants, to rate their perceived level of support and resilience pre and post application of these leadership strategies. So first, collect baseline information pertaining to how they perceive COVID-19 and what impact it had on their working conditions, their shift in their culture, and then nurse satisfaction or job satisfaction. Then following the implementation of these strategies, evaluate whether these nurses feel better supported to really answer that original question or that original challenge that I had advertised. What this whole presentation is about is the prolonged effects of the COVID-19 pandemic. So since implementing your leadership strategies, have working conditions improved? Do you feel better supported? And then how do you demonstrate resilience in workplace? Really start that conversation, because that will also lead you or help perpetuate maybe better solutions in the future. This whole leadership thing and introducing these leadership strategies is not a one-time fix-all. It's definitely a conversation, a two-way street where we learn from each other as leaders, other leaders, but then you're also learning from your followers constantly. So what does this, with all this feedback, this evaluation, then what? Do we just sit on it and say, oh, they're feeling better supported, that's great? No, we act on it. Because what about if those results, what about if we're not meeting those SMART goals? What about if we're not seeing that nurses are saying, because you approach leadership slightly differently and you've empowered us, or you're making us feel empowered, and we're part of that table, we're part of that conversation with a shared decision making and taking on roles and responsibility, but we still want to leave this profession and we still feel burnt out because you haven't come up with brand new nurses to fill the staffing gaps. So what does that look like? Does this mean that with this feedback, with these evaluations, should we consider reshifting that leadership and management on the unit, and that and what that construct looks like? So I know some of our units here at our facility have clinical leads or charge nurses, but they take on a whole array of responsibilities. So is it time to make clinical leads, whose main role is to provide leadership, more accessible and present on the unit, so that they can do a better job at really focusing on leadership? The research does say that managers that are expected to lead on the side certainly don't do as good of a job as somebody who has training in leadership, and then whose role is to watch their followers, have conversations with their followers, and then provide that meaningful, timely feedback. And that could be as simple, this meaningful feedback that I keep referring to. It could be as simple as just a good job in the morning huddle, or an email, or a kudos board saying, hey, so-and-so did a great job. And then that little level of worth that really takes nurses a far way, or takes anybody a distance. So, and that clinical lead position will probably alleviate the pressure from charge nurses as well, because charge nurses are there hustling and bustling with the daily grinds of the units, and their roles, although similar, aren't quite the same. And then that's also identifying specific roles and responsibilities so that people know what their jobs are on the unit. And then people can focus more so on maybe transformation leadership maybe that's the start of improving the leadership tactics on your unit. And then the cultural change toolkit, that's a constant cycle of learning and revamping. So a clinical lead would actually have that time to put into it. Qualitative data that is collected can also be applied to new approaches in leadership, and then also cultural change. This feedback loop provides a forum for information sharing, idea generation, collaboration, and then shared decision making. And then evaluations can be better used to elicit these changes in the future, what it looks like for future nurses, for the group, and then furthermore, follower buy-ins likely to greater if they contribute their ideas, and if they feel like their ideas and personal needs are being addressed. So in conclusion, research pertaining to the effectiveness of leadership strategies in various healthcare settings is limited. Hypothetical leadership styles have been designed with the intentions of making a difference, but the true impact is rarely formally evaluated. That's why we're here today, to learn what can we do as nurse leaders, what can we actually implement to make a difference. There are needs for future studies future studies are required to measure the impact of productive leadership styles, especially amidst the aftermath of the pandemic. And then in conclusion, to start an individual unit level will provide these nurses the support they need. By empowering our staff, engaging them in cultural change as nurse leaders, we should be able to understand our employees' needs, wants, and desires to achieve the end goal of increasing job satisfaction and nurse retention. The best approach to developing resiliency is first forming a supportive environment where the individual is empowered to be part of positive change. Thank you so much for listening to my presentation. There's a reference list if you have linking you to the cultural change toolkit, and then we can facilitate any Q&A afterwards. Thank you very much.